Now, we've heard this week a number of warnings about irresponsible COVID-19 behaviour. One medical professional noting that another hard lockdown is unnecessary. I want to introduce you to Dr. Atiya Mosam, a public health medicine specialist. She believes that South Africa will not return to a hard lockdown soon, but she is concerned that people's behaviour is a cause for real concern. Doctor, good afternoon to you and welcome. At what point would you start considering ramping up a lockdown? Are we at that point yet?
Thanks, Jeremy. Look, if we look at the numbers over the past 2 months or so, we've seen a steady decline. And we've gotten to a point, though, where the numbers are low, but not negligibly low enough for us to become complacent. I think if we do start seeing a uptick of cases to the extent that we see that the cases are doubling quite fast, we would then have to consider additional measures. I think, though, that again, the same with March, it would be a decision that wouldn't be taken lightly. We've seen the effects of the lockdown in many spheres, employment, in terms of food security, etc. So I think, we will be watching the numbers, but it wouldn't be something that would be a decision that would be taken spontaneously or without a lot of forethought.
You would be concerned, surely, about the numbers in the Eastern Cape province. It's witnessing a resurgence that is on the record. We're also starting to hear reports of hospitals filling up. Would additional measures in a case like that be necessary?
So, I think one of the good things about the early lockdown was that it allowed the health system to be, readied to some extent. And I think now possibly the way to handle it would be on a very contextual basis. So it might not be, for example, necessary to put in measures across the country. But, for example, in the context of the Eastern Cape, we would have to put in additional measures to protect that population as they are seeing the increase in cases at the moment. So I think it would be, to some extent, context specific. And, we have to take into account each of the provinces, their population, their mobility, etc., before we put into place any decision.
Again, you're not an expert on the Eastern Cape, I understand that, but has that province potentially reached a point where that evaluation of the context, as you put it, needs to be taken more seriously?
So I do, as you say, I'm not an expert in the Eastern Cape, but we do understand that the Eastern Cape is one of our rural populations, and with that comes a slew of associated issues in terms of access to healthcare, not having the facilities that, for example, Gauteng would have. And so there does need to be some interrogation of the health system there in terms of what additional measures are needed for that population. The Eastern Cape also is an area where people do return to at the end of the year, and we are going to see lots of people moving as we get to the holiday period. So I think measures do need to be put into place for the Eastern Cape to ensure that we don't inadvertently increase the cases there.
Doctor, just a final question to you. You say that current behaviour among all South Africans is troubling, but you'll concur with me that we're sick and tired of this. We're tired. We've had enough. How do you force that change in behaviour without becoming punitive?
It's very difficult, Jeremy. It's not just about us being sick and tired of it, which we all are. It's difficult to sustain behavior. We've all tried to sustain, for example, exercise behavior or dieting behavior, and so we know. And I think it's easy for us to sustain behaviors when we are in level 5 lockdown, when you go out and you see no one and there's only a certain amount of things you can do. But as you return to life and as you return to your activities, you do become, to some extent, complacent, because it's also quite difficult for people to have to think about these measures with everything that they do. And I think, you can't be punitive, you're right, and it's also very difficult to be punitive, to regulate everything. But I think, if from everyone, from government all the way down to citizens, if we all, just try and be a bit more vigilant, as much as we're sick and tired of it, Simple things, ensuring that we are distancing, ensuring that we are taking the measures that are simple. So, the hand washing, the sanitizing, wearing the masks, simple things like that do go a long way, as small as they may seem. I also would call on businesses. I've noticed a bit of complacency from businesses, restaurants, even some of the malls that we go to. There is a bit of complacency around that. So, just trying to enforce it where you can in a gentle manner that acknowledges that people are humans at the end of the day as well.